I received a question about glycogen storage disease, and also arthritis and gout, which means the person in question has high uric acid levels, and which means he is definitely insulin resistant, because insulin resistance upregulates uric acid on the kidneys. The question that he posed was, can he do the carnivore diet? And the answer is absolutely yes. You can do the carnivore diet, and it will be beneficial for you, for the simple reason that look at what brought you the disease in the first place. So let me explain the glycogen storage disease. So glycogen is the storage for glucose in the liver. So what happens is, if we eat carbohydrates, the carbohydrates of course goes to glucose, and now we have too much glucose in the blood. So insulin facilitates the body to get the glucose levels down. So where does it put the glucose? It puts it into glycogen in the liver. So the glycogen storage gets full. So if you eat too much carbohydrates, then you have a problem. So if you struggle with glycogen storage disease, or problems with the liver, it's absolutely beneficial to do a diet that reduces the strain that you put on your liver. So if you continue to eat in a high carbohydrate fashion, and you continue to have high glycogen storage needs, with other words, you have too much glucose that needs to be stored, then there's no more space in the liver for the glycogen storage. So where does the body put that glucose? The insulin then facilitates again and put that glycogen into triglycerides. Triglycerides is the fat component in the body and in the blood that goes up when you eat too much carbohydrates. It's got a 2.1 risk factor for heart disease. So then you develop fatty liver and fatty pancreas, and your inner fat becomes more. So discuss it with your doctor, as I always say, and unless he discourages you not to do the carnivore diet, I would really, if I were in your position, I would really consider it strongly together with your doctor. And if you are on medicines, of course, that has to be taken into account as well, because as you will heal and your insulin resistance go away, your medicine will need to be adjusted downwards. It's very important that you do it before you start the carnivore diet. But thank you for the question, I appreciate it. So insulin resistance is the cause of all the major diseases, or most diseases in the body, and it makes it worse. So there's a lot of inflammation and other things that go wrong. Cancer mortality risks of 90% if you are chronically hyperinsulinemic. So if a person struggles with high uric acid levels, you can with confidence say that that person is definitely in chronically hyperinsulinemic, because high levels of insulin upregulates the uric acid on the kidneys. So I've got videos about high uric acid. I'm not going to talk about that now, but thanks for the question. The other reason why the carnivore diet will be beneficial for somebody that suffers from liver failure is because of oxidative stress. With other words, all the things that we are consuming, like pesticides, herbicides, food colorants, emulsifiers, stabilizers, all those things that are, and unsaturated seed oils, cause oxidative stress, which enhances insulin resistance even more. And it puts strain on the liver, because the liver pays the ultimate price. And so this is the question, then. What other diet would you follow if not the carnivore diet? And that's the question you need to ask your doctor when you speak to him. Because I always ask people, what diet should you follow? Would you follow a diet high in carbohydrates, high in unsaturated seed oil such as canola and sunflower, which is absolutely bad for you? Would you follow a diet high in fiber? Or what would you follow? Or would you follow a proper human diet, proper human nutrition? All the nutrients your body needs are within the carnivore diet. In other words, if you want to give your body a fighting chance to get rid of inflammation, for instance, an elimination diet, such as the carnivore diet, and a low carbohydrate diet, such as the carnivore diet, would be beneficial. It's like when you look at an animal and an animal is not well. What would you give that animal that is not well? Would you give him another diet, unlike what he was supposed to eat, or would you give him species-appropriate, correct food? And the answer is you will give him species-appropriate, correct food. With other words, a proper species-appropriate diet. And in our case, in my opinion, it's the carnivore diet. So it's part of a spectrum. We support Banting, Ketovore, and of course carnivore and the Lion diet. So check it out. It's video number 83 and 84 on my blog. Only people that really should not do the carnivore diet, and that's according to the carnivore doctors, is people with less than 30% kidney function left. Because of us eating a lot of protein, your kidneys should have more than 30% kidney function. Regarding your gout and arthritis, remember, with the carnivore diet, you will expect to have an adaptation phase. So initially you might struggle with the uric acid, as the uric acid will compete with the ketones to be excreted via the urine. But talk to your doctor so that maybe he can give you medicine like Puricos or whatever medicine you are on, just to help you with the adaptation phase. But remember, the uric acid comes from you being insulin resistant. We need to fix, or you need to fix, the insulin resistance, which is the culprit. It's not the red meat. I've got videos about that. So I said, don't want to elaborate. Go and check out those specific videos on my frequently asked question playlist on my YouTube channel. We've also done an interview with a lady recently who reversed her arthritis with the carnivore diet, and that video is on the testimonial playlist on my YouTube channel.